Hello, everyone. This is Dr. Kelly Brock, Psych Mental Health NP Concentration Coordinator at Frostburg State University. I have developed this tutorial at the request of Ms. Julie Miller, our Clinical Placement Coordinator. There have been a number of questions generated by all of you as admitted psych mental health NP students, and Julie and I both thought that it would be very helpful if I developed a very specific tutorial to help prepare you to partner in clinical site and preceptor identification and placement. Today's date is August 8th. The first thing that I wanted to include in this tutorial is just a review of the full-time psych mental health progression plan. I know that you already have this document. If you need another copy, please let our administrative assistant know, or you can find it on our web pages. It is currently updated and available for anyone that is interested. I just wanted to start by calling your attention to a couple of different things. Number one, for your first 2 semesters in the program, you'll notice that you will be taking a lot of core and core MSN courses and core nurse practitioner courses, but no psych courses. You will not begin your psych studies until the 3rd semester, which will start in the summer of 2019. And the first 2 courses are listed here, and they are didactic and completely online. It is not until your 4th semester in the Psych Mental Health NP program that you're going to begin your practicum experiences. That being said, let's take a look semester by semester at the practicum requirements. So again, you will not begin your practicums until the 4th semester, which for you falls in the fall of 2019. You will begin with psychiatric diagnostic reasoning across the lifespan for 135 hours. In the spring of 2020, the focus is on the adult and geriatric population. You'll see that there are 2 separate and discrete practicum courses, and while there are some absolute differences, you can kind of look at them through one lens. So you're going to have a therapeutic management of adult and geriatric psychopathology for 135 hours. And then you're going to have a separate 1-credit practicum devoted exclusively to adult and geriatric focused brief individual and group therapy for the Psych NP. So you will be completing a total of 180 hours for this semester across 2 practicums. Semester 6, summer of 2020, is exactly the same thing, except your age focus is on children and adolescents, but you'll see that the courses are the same, it's just the age ranges that are quite different. During your last semester, or the 7th semester, fall of 2020, you will be completing the therapeutic management of vulnerable populations psychopathology across the lifespan for a total of 135 hours. So while there are officially 6 separate practicums, they only run across the last 4 semesters of your program, and there is definitely some overlap. During the remainder of this tutorial, I'm going to go over each individual practicum. I'm going to provide a very quick course description, then identify the age focus, recommended types of sites that can be used, and the preceptors that will be needed during those practicums. So Nursing 628 is the very first practicum that you will complete, and this is all about coming up with the correct diagnosis, I guess, if I was to summarize it in a sentence. So you can read for yourself the description, but the entire course really revolves around learning how to conduct a complete biopsychosocial psychiatric interview, the different components, what questions to ask, how to ask questions that are age appropriate, how to ask those questions with different patient presentations, and all of the nuances that are involved in coming to the correct primary diagnosis while developing a list of differential diagnoses. The age focus is across the lifespan. Recommended types of sites include an outpatient psych practice, inpatient unit across the lifespan, or perhaps a psychiatric ED. Those are not all inclusive, and other sites can definitely be considered with my approval. Preceptors include a psych mental health NP, psych mental health clinical nurse specialist, or a CNS, or a psychiatrist. Some students have been asking for very discrete course objectives for the practicums to provide to the preceptors. And although I have included those slides in this PowerPoint for your reference, I don't know that it would make a whole lot of sense to go over them verbally with you because you haven't had the first 2 semesters worth of coursework or 3 semesters worth of coursework to really be able to make much sense of these objectives. So again, while I've included them in the PowerPoint and they will be available to you to provide to preceptors, they may not make a whole lot of sense at this point in time before you begin the program. Nursing 631 is therapeutic management of adult and geriatric psychopathology. So this is the co-requisite of Nursing 630, which is the theory course, and this is the sister practicum course. So the goal here is for you to take the skills that you have learned in 630 and then to actually refine the actual advanced practice skills in the acute and chronic clinical management of the biopsychosocial problems in this population. So now that you have learned how to correctly diagnose patients, you've learned how to develop primary or working diagnoses and differential diagnoses, now you're going to take this population of patients, you're going to correctly diagnose, but now we're getting into the management of this population. What does that management look like? Well, it could be intervening in using a therapeutic modality like cognitive behavioral therapy. It could mean needing to rule out medical diagnoses. So you may be recommending ordering labs or diagnostic tests. You may be involved in starting, continuing, or discontinuing medications. Not you literally, but making the recommendation to do so. This may involve making consultations to other healthcare providers or other psychiatric service lines. It could involve a lot of different things. Again, you're looking at the whole patient and you're treating the whole patient. So it builds on the psych diagnosis course, and now you're adding on and you're making treatment recommendations. The age focus for this practicum is ages 18 and older through geriatric. You absolutely must have some patients that are age 65 and older. Recommended types of sites include outpatient psych mental health practice, inpatient psych units, maybe some correctional facilities, and skilled or assisted living facilities also. Preceptors that would be appropriate include psych mental health NPs, psych mental health CNSs, or a psychiatrist. Again, these course objectives are in the PowerPoint, and you can certainly look at them or share them with your preceptor if you would like, but I won't be going over them in detail. Nursing 633 is the adult geriatric focused brief and group therapy for the Psych NP course, and this is 1 credit hour or 45 clinical hours. So the goal of this practicum, this is the sister course to Nursing 632, where you will be learning all of the theoretical concepts of psychotherapy. This practicum course really gives you the opportunity to develop those beginning skills, those novice skills in the practice of brief individual therapy and group therapy with the adult GERE population within the scope and standards of the Psych NP role. So you're not going to be doing complex dialectical behavioral therapy or complex trauma-based therapy in this course. We're wanting you to develop novice beginning skills that would be appropriate for a psychiatric NP in practice. The age focus is adults 18 and older through geriatric age. Recommended types of sites include outpatient counseling mental health practices, inpatient adult and/or GERE psych units, skilled and assisted living facilities, substance use related treatment facilities, etc. Again, this list is not all inclusive, but it gives you a starting point. Preceptors for therapeutic courses are extended. So in addition to a Psych NP, Psych CNS, you can also consider a PhD psychologist, a PsyD psychologist, an MSW, LCSW, or an LCPC. Again, I have included course objectives for this therapeutic course, and they are available to you to review. Nursing 635 is Therapeutic Management of Child and Adolescent Psychopathology for 135 hours. So this course really does mirror the last management course with adult and geriatric patients, except the age focus is quite different. So hopefully at this time you will be able to take all of the skills that you have learned thus far in the Psych Diagnostic Reasoning course, the Management of Adult and GERE course, and the Adult and GERE Therapy course, and now be able to manage child and adolescents across whatever diagnostic issue they're dealing with. The age focus here is on children and adolescents under the age of 18. You could use sites that include an outpatient psych mental health practice, an inpatient psych unit that is child and adolescent age specific, perhaps a Department of Juvenile Justice facility, residential treatment facility, maybe a special school for children with psychiatric, emotional, behavioral problems. Those types of sites would be appropriate. And again, you're moving beyond just diagnosis, but here we're making an accurate diagnosis, and then we're treating the whole child, or in some cases, the entire family, if we're talking about a family intervention. So we're talking medications, referrals, ruling out medical issues, collaborating with other people on the treatment team. Again, you are treating the whole child from a bio-psycho-social perspective. Preceptors that are qualified and appropriate, again, would be a Psych Mental Health NP, Psych Mental Health CNS, or a psychiatrist. Again, course objectives are available for your review. Nursing 637 is the Child and Adolescent Focused Individual and Family Therapy for the Psych NP Practicum course. It is the sister course of Nursing 636, and here you will be given an opportunity to develop beginning novice skills in the practice of child, adolescent focused individual and family therapy with patients and their families within the scope and standards of the Psych NP role. Again, no complex therapy. You're not going to be conducting the family therapy solo with challenging populations. Again, the goal here is really to parse out the therapeutic interventions and make sure that you have a minimum of 45 practicum hours that are devoted to the development of that skill set. The age focus is children and adolescents under the age of 18. Recommended types of sites: outpatient counseling mental health practices, inpatient child and adolescent psych units, residential treatment facilities. Maybe you might have an opportunity to do some practicum hours with mobile therapy or family therapy units or departments. That would be fantastic. Again, you'll see an extended list of preceptors for this practicum: the Psych Mental Health NP, CNS, a PhD psychologist, a PsyD psychologist, an MSW, LCSW, or an LCPC. Once again, you will find the specific course objectives available. And the last practicum in your program is Nursing 639, which is Therapeutic Management of Vulnerable Populations Across the Lifespan for 135 hours. This really is the putting it all together practicum. You already know that every population within psychiatry is a vulnerable and special population, so you will be able to focus on any age range, and the recommended types of sites are many. You can use an outpatient or inpatient psych practice, correctional institutions, a population-specific treatment facility, substance use treatment facility, maybe an eating disorder unit, anything. It would be difficult to come up with a possible site that would not qualify for this practicum. Preceptors that are qualified for this rotation would be a Psych Mental Health NP or CNS and a psychiatrist, although I will consider others if you can make the case. So this course is going to focus on the experiential learning and practice application of theory and concepts relevant to the management of psychopathology in vulnerable subpopulations experiencing psychopathology across the lifespan. The focus is on selected theories and principles from the physical and behavioral sciences, central to planning, implementing, and evaluating therapeutic regimens unique to these vulnerable subpopulations. Emphasis is also placed on understanding the unique contributions of social and cultural factors in the development of appropriate treatment plans. This course builds directly on the knowledge base developed in all previous courses specific to the Psych NP track. It also integrates a knowledge base developed regarding the scope and standards of practice of psych mental health nursing and multi-organizational position statements. That's a mouthful. But it really is putting everything all together. And by this time, you will really have had all of the theory and the didactic information and knowledge that you will need. Now you're just applying it to some of these more specialty vulnerable populations within the psych mental health realm. Again, I have included the course objectives for your review, or if you care to share with a potential preceptor or site. Just a couple of concluding thoughts. Keep in mind that some sites and preceptors may be useful in multiple practicums, and in many cases that's fine. Let me give you a for example. Brook Lane is a facility in Hagerstown that has a number of different service lines. They have inpatient units, a child unit, an adolescent unit, an adult unit. They have the ability to perform ECT. They have a huge outpatient practice with multiple satellites, and they employ psychiatrists and quite a number of psych NPs. They have a special school. They have a residential treatment facility. They have a child and adolescent partial hospitalization program. They have an adult partial hospitalization program. I think maybe the only service line that they don't have is substance abuse specific. So if you were looking for almost a one-stop shop, a facility like Brook Lane may be something that you would want to consider. Sheppard Pratt is also a very good example of a psych mental health machine that has a ton of service lines. So again, you may very well, if you were to get in with one of those places, you may be able to do almost all of your hours at one facility because they have so many different service lines. Please note that a variety of experiences is strongly recommended. The more that you are exposed to, the more you will understand what you want your practice to be like and what you don't want your practice to be like. So I absolutely recommend a variety. Also, please know that each practicum course builds on previous courses while learning additional information concurrently. Our program is not like a lot of the redesigned programs that are in existence today, where you spend the first year, year and a half in the classroom, and then you spend the last year in residency. That's not how our program works. Our program is scaffolded with practicum experiences throughout. We believe that that really helps students connect the theory with the application, and we feel like that is a preferred way to really develop some expert skills by the time you leave our program. If you have any questions about what is contained in this tutorial, you can contact me as the Psych Mental Health NP Coordinator. My contact information is on this slide. Or you can contact Ms. Julie Miller if it is a question that you think she would be better suited to answer, and her contact information is on this slide. Thank you so much for your attention. Please let me know if this information is helpful to you. And if it is not helpful to you, please let me know what additional information would be helpful. Thank you so much.